Today's topic hits home for many of us, as it can affect anyone, including our loved ones, the often overlooked signs of mini stroke in seniors. But before we dive into the meat of today's discussion, did you know that every 40 seconds someone in the world suffers a stroke? You heard that right. About 800,000 people have a stroke every year. Now, what if we told you that mini stroke, aka transient ischemic attack, TIA, often goes unnoticed and can lead to severe conditions down the line? Today, we will shed light on the life-saving tips that can help you identify the subtle signs of a mini stroke. It's a topic that deserves your attention because recognizing these signs early on can mean the difference between a full recovery and a life-altering event. Stick around, as we'll be covering the telltale indicators, risk factors, and immediate actions you can take to ensure the best possible outcome for your loved ones. Before we go any further, let's take a moment to understand what mini stroke is all about. Many often misunderstand and underestimate mini strokes or TIAs. Despite their name, mini strokes are anything but inconsequential. They occur when there is a temporary disruption or blockage in the supply of blood and oxygen to the brain, causing sudden, short-lived symptoms similar to those of a stroke. While the effects may fade quickly, never take it lightly. Mini strokes are warning signs for impending major strokes and demand urgent attention. So, without further ado, let's jump right into the signs of mini stroke in seniors. 1. Numbness or weakness in the face, arms, and legs. Numbness or weakness in the face, arms, and legs, especially on one side of the body, can be a warning sign for a mini stroke. This phenomenon often occurs due to a temporary interruption of blood flow to the brain. As a result, the affected individual may experience a sudden loss of control over their muscles and bodily movements. When this happens, it can result in hemiparesis, a paralysis on one side of the body. The brain sends signals to move the arms and legs, but a lack of oxygenated blood can disrupt these signals. This process results in a malfunction in the control center, sending confused messages to the face, arms, and legs. 2. Facial drooping. Facial drooping is another prime indicator when identifying signs of a mini stroke. The lack of oxygen-rich blood can affect the facial nerves, causing a loss of muscle control and noticeable facial drooping. The most common cause of mini strokes is atherosclerosis, where fatty deposits build up in the arteries, narrowing them and restricting blood flow. When this happens in the arteries supplying blood to the brain, it can lead to TIAs and subsequent symptoms such as facial drooping. Even though mini strokes may not cause permanent damage like full-blown strokes, you should never brush them off lightly. If you or a loved one experience sudden facial drooping accompanied by other symptoms such as weakness or numbness in the arms and legs, seek medical attention immediately to assess and mitigate any potential risk factors for future strokes. 3. Dizziness and loss of balance. Many are unaware that dizziness and loss of balance can be telltale signs of a mini stroke. Essentially, when the brain doesn't receive enough oxygen during a mini stroke, it can trigger a cascade of sensory disruptions, leading to dizziness and instability. The impact on specific brain areas responsible for coordination and spatial orientation can result in sudden episodes of unsteadiness or even vertigo. Moreover, mini strokes can damage the inner ear, which helps detect changes in head position and maintain equilibrium. This damage can contribute to ongoing issues with balance and dizziness even after the initial episode has passed. Sometimes these symptoms may only last a few minutes and dissipate, but you should never ignore them. The link between mini strokes and dizziness highlights how crucial it is to seek immediate medical attention, as these warning signs could pave the way for preventing a severe stroke in the future. 4. Trouble walking and lack of coordination. It may come as a surprise to many that a mini stroke can lead to difficulty walking. The interruption of blood flow to the brain can cause neurological symptoms, including limb weakness and inability to coordinate oneself. These symptoms can make walking challenging and increase the risk of falls, especially in elderly individuals who may already have age-related mobility issues. In addition, the impact of a mini stroke on the brain's cognitive functions is significant. The damage can impair spatial awareness and decrease muscle control, natural processes for maintaining a steady gait and stability. This problem affects physical mobility and contributes to an individual's confidence and independence. As TIAs often go unnoticed or are mistaken for other less severe conditions, it's crucial to recognize these signs as potential indicators of a serious issue. 5. Sudden confusion. The brief episodes of blood flow disruption to the brain can prevent normal brain function, leading to various symptoms, including confusion or brain fog. Mini stroke impairs the delivery of oxygen and nutrients to the brain, causing sudden cognitive impairments. This interruption can cause temporary disorientation as the brain struggles to maintain normal processes. Many strokes may affect different brain parts responsible for memory and decision-making. As a result, sudden confusion can arise from this interference with essential brain activities. Moreover, repercussions leading to sudden confusion often go beyond the immediate episode. Research shows that recurrent confusion can have cumulative effects on cognitive function, potentially increasing the risk of developing long-term conditions such as dementia. It's vital to recognize these signs promptly and seek immediate medical attention, as mini strokes are often warning signals for serious health issues such as a full-blown stroke. 6. Trouble speaking. Mini strokes can reduce an individual's ability to communicate effectively. It often prevents the functioning of the language centers, leading to the inability to speak coherently. The lack of proper blood flow affects the brain's ability to process and produce speech, resulting in slurred speech, difficulty finding words, or even complete aphasia. Many strokes are different from full-blown strokes due to their temporary effects. The impairment of speech due to mini strokes highlights the importance of seeking immediate medical attention and adopting preventative measures such as exercise, a healthy diet, and medication management to prevent long-term communication difficulties. 7. Trouble comprehending others. While many stroke symptoms may resolve within 24 hours, they can have long-term effects on cognitive function. One such effect is the inability to comprehend others, manifesting as difficulty understanding speech or processing information. Reduced blood flow to brain areas responsible for language and comprehension can result in impairment in understanding spoken or written communication. This condition affects the individual's ability to engage in conversations and hinders their capacity to follow instructions, read effectively, and interpret complex information. The frustration and isolation from these challenges can reduce the quality of life and interpersonal relationships of seniors suffering from mini strokes. Understanding these cognitive implications is crucial for providing appropriate support and interventions for mini stroke patients. 8. Difficulty seeing. Mini stroke can lead to temporary vision problems due to the reduced flow of minerals and nutrients to the brain and eyes. In this case, the brain part responsible for processing visual information becomes compromised, resulting in difficulty seeing or interpreting what one sees. The visual symptoms of a mini stroke may include sudden blurriness, double vision, or even partial loss of sight in one or both eyes. Depending on which brain part the mini stroke affects, visual disturbances such as tunnel vision or seeing flashing lights may also occur. The impact of a mini stroke on eyesight can be frightening and disorienting. Addressing mini strokes with vision changes is essential for recovery and preventing future episodes, underscoring the critical role of eye health in overall neurological well-being. 9. Severe and sudden headache. Unfortunately, mini strokes can often go unnoticed or be mistaken for other mild conditions. However, it's crucial to be aware that a mini stroke can manifest itself through severe and sudden headaches. This condition can occur due to blockage or low blood flow in a blood vessel in the brain, resulting in intense pain and discomfort. The insidious nature of this symptom necessitates swift medical attention to assess the underlying cause and prevent potential long-term consequences. Moreover, the severity of the headache following a mini stroke can vary from person to person, making it even more challenging to recognize. In some cases, individuals may experience excruciating headaches akin to migraines or cluster headaches, while others may report milder but persistent discomfort. This variation underscores the need for thorough evaluation by healthcare professionals when such symptoms arise to determine whether they indicate a mini stroke or another condition. Understanding this link between mini strokes and severe headaches is essential for timely intervention and preventing complications in elderly individuals. 10. Difficulty swallowing. Mini strokes have varied and puzzling symptoms. One lesser-known effect of mini strokes is the onset of difficulty in swallowing, a condition known as dysphagia. When a mini stroke occurs, it weakens the brain area that coordinates swallowing. This disturbance in normal brain function can impair the coordination and strength of the muscles that control swallowing, leading to difficulties in moving food or liquids from the mouth to the stomach. In addition, Mini strokes can damage the nerves that initiate swallowing. The impaired nerve signals between the brain and muscles can reduce sensitivity and awareness of food entering the throat, an essential mechanism for preventing choking or asphyxiation. A reduction in sensation increases the risk of food or liquid entering the airway instead of reaching the stomach. This malfunction can lead to potential complications such as coughing while eating or drinking and susceptibility to chest infections like pneumonia. Interestingly, some individuals may experience dysphagia as an isolated symptom of a mini stroke without other classic warning signs like weakness or numbness. This variation emphasizes the importance of recognizing this sign to ensure prompt medical attention and appropriate management. Moreover, addressing dysphagia resulting from a mini stroke often requires a multidisciplinary approach involving speech therapists and neurologists to help retrain swallowing muscles and manage underlying vascular issues that contributed to the TIA. So, if you experience or notice these symptoms in yourself or your loved ones, don't brush it off as mere fatigue. The body could be warning you about a potential mini stroke. Being able to recognize these signs and act swiftly could make all the difference in getting timely medical help and preventing further complications down the line. Keep an eye out for such symptoms in yourself and your loved ones. After all, being informed could save lives.